I would like to introduce our second speaker, Dr. Kevin Hedges, who is the president of Workplace Health Without Borders. And so, Kevin, are you ready to take it away?
The first thing I want to do is just acknowledge Dave Zorc. So Dave Zorc sits on the Workplace Health Without Borders Board of Directors, and he actually also presented about control banning some time ago. And he's produced the book, so if you want to find more about control banning, I recommend that you read his book. It really goes into the detail, and Dave was very generous. And when he presented, he actually, people would buy his book. The proceedings for his book actually went to Workplace Health Without Borders. I also just want to acknowledge all of the past speakers. We have our YouTube channel. You can see lots of presentations around schools from Lydia Morawska, Dr. Joseph Allen, also Ihai Iden from Osha Africa, and also from Dr. Duong Can Van from the Vietnam National Institute for Occupational Environmental Health, and they're on our YouTube channel as well. Just Workplace Health Without Borders, we truly are international. And just before I move on, I also really want to thank Larry Sloan for helping us work more closely with his organization, and also Chris Lasses Davis for helping cement the organization so that we're not duplicating effort. This is our vision and mission, and we're actually revisiting our mission at the moment. We have a committee set up to actually revisit our strategic framework. But we are really, if you think about COVID, there's no real division between public health and occupational health. It's all interrelated. So it truly is about looking at a world in which workers, their families and communities do not get ill. And this is from the synergist, Larry, just no boundaries. And I also took this from Dave Zorc's presentation as well. Thank you, Dave. So it really talks about IH's role in prevention, the transmission of a highly hazardous communicable disease. So the control banding presentation from Dave Zorc is on the YouTube. And I highly recommend you go back and look at that. So really, I don't really want to go through all of this, but if there's not an exposure limit for a particular hazard, then control banding really lends itself to it. So coronavirus is an example where there is no exposure limit. So we really need to think about the different levels of risk. So coronavirus is the hazard, and we think about the exposures as the likelihood of getting ill. I also am an occupational hygienist with the Occupational Health Clinics for Ontario Workers. So I'm also sharing, information that we've prepared for OCAO as well. This is the matrix that's been developed. It's a model based on the OSHA risk levels, the 4 different risk levels, and it's aligned with the hierarchy of control. So if you think about elimination, physical distancing being the most effective control, then mask wearing is a lesser effective control because you're relying on people. But if we think about where schools would sit, they would sit at the medium risk column there. And I just want to get you to look at the very lower level, the lower row on where the personal protective equipment is, that where there's really high community transmission, there may be a requirement for certain people to wear respirators rather than masks. This is a really good risk communication tool because it sort of puts it in context. If you're a healthcare worker in a COVID ward, for example, then you fit in the very high risk. And I've just provided hyperlinks to the Canadian standard for respiratory protection, for example. If we bring that back down to education, as I said, really, we probably wouldn't go above medium risk, but it really helps you sort of conceptualize, how to control the risk. So, we need to think about each part of the hierarchy of control here. I've also included a hyperlink to a ventilation risk calculator. which I'll talk about in a minute. Also, Marianne Levitsky gave a presentation on rapid testing in one of our past webinars, and she looked at the good things about screening using antigen testing. And also, there's a very good risk matrix from the British Occupational Hygiene Society, which, it points people to where respirators are required. So I provided a hyperlink to that. Also, Simon Smith, who represents the International Society for Respiratory Protection, provided a webinar, and I provided a hyperlink to his webinar. And Dave Zork from Lawrence Livermore Laboratories provided this matrix. So this is a very useful matrix too. And I'll just get you to look at also, in line with schools, for example, where you cannot physically distance. If you really look at this and the detail in this, it's talking about respiratory protective equipment. Think about James Reason's, the cheese and the holes in the cheese model. So each of these layers are a barrier of prevention. And when you line up the holes, then you get the coronavirus coming through the different barriers. So what this tells me is how important all these different barriers are. There's going to be a lot more focus on ventilation. Lindsay Maher, an engineer and aerosol scientist from Virginia, is really a big player in this whole field here. And, she's really been a great leader to promote the importance of aerosol transmission in a number of different environments. And this is a tweet that I found from her not so long ago. This was a gym where they did screening, cleaning, masks, and also reduced the capacity of the gym to 50% capacity. But they ended up with getting 44 primary cases and 17 secondary cases, and there was no discussion about ventilation. Teresa Tam is the Canadian Chief Public Health Officer, and recently she came out and has acknowledged the airborne transmission route. When I was preparing for this presentation, I looked back on the Worldometer coronavirus numbers. It's quite, apart from Johns Hopkins University, it's a good way just to keep track of what's going on. And I was astounded, like if you were looking at the number of deaths per million in the US, for example, compared to the number of deaths per million in Japan, the difference is phenomenal. I think I came up with a number 52 times greater in the US. When I sort of went to the Japanese website, I came up with this infographic. So if you think about closed spaces, crowded places, close contact settings, the 3 C's, and you overlap those circles, and right in the middle where you see that red zone, that's a really high risk. So that's really emphasizing the importance of not being in closed spaces with poor ventilation. And so really, as we move forward, we're going to find that ventilation is going to get a lot more attention. And this is just a section from the Canadian Committee on Indoor Air Quality document just released. It talks about reducing the level of carbon dioxide. And it talks about where they increased ventilation, under-ventilated buildings in universities, they reduced carbon dioxide levels from 3,200 parts per million to 600 parts per million, was sufficient to halt ongoing transmission of tuberculosis in university buildings. Joseph Allen, he's really been a leader in the field. Professor Joseph Allen, he presented at the Workplace Health Without Borders webinar not so long ago, along with Lydia Morawska, and there's some fabulous guidance there from Harvard and for Health Schools for Health. There's a fella I've just connected with from ISIAC, Brad Present, and the very first tool there on the top left-hand corner provides a risk calculator and it's based on room dimension, occupancy, and air supply. And I just recommend that you look at each of these different tools. And I think as we move forward and we think about ventilation a lot more, these will be very useful. And just thinking also about Joseph Allen, Professor Joseph Allen, there's also a Harvard CU Boulder portable air cleaner calculator for schools. And I just really want to also say thank you again to Larry Sloan and the leadership that he's shown with the AIHA. And, you know, many of our members, WHWB, are part of AIHA. And Steve Thigerson's done fabulous work as the lead of the International Affairs Committee. And I just wanted to use my talk as a bit of a catalyst moving forward. So I didn't really want to speak too long, but I just wanted to, I guess, whet your appetite with the discussion moving forward.